Long WSAV is unmasking domestic violence in the Coastal Empire and Low Country. This Wellness Wednesday, we continue our discussion about the mental health impacts of violence and abuse. We started last Wednesday. Mary Jo Horton is here to help us out with that, sort of navigating this space. So last Wednesday, we talked about the individual and domestic violence and how to respond to someone who's in that sort of a situation, but it really is a community-wide issue.
Correct.
Yeah. So talk about the ways it impacts our communities, because it's all over.
Right.
Yeah.
So think about it when families are going through this. So you're talking about victims of domestic violence not working, their productivity, children in school, they're not functioning, they're distracted, their mental health. Our pets are being abused, and that has a lot of impact on our community. So when you look at all levels of productivity, access to health, our physical health issues, the entire community is impacted by domestic violence.
So productivity, and it's expensive. You get into physical health and the treatment, and
Right, you know, and not just like the physical violence from it, but the physical stress of having to go through that. And even, you know, when you think about children, you know, you think about their stress and how that takes a toll on their mental health, and them going to the doctor, winding up with stomach issues, them not being able to perform at school. Then if they can't be at school, then someone's going to have to pick them up, and then that person can't be at work.
Yeah.
It affects everybody.
Okay, so domestic violence can have an impact on the mental health rates in a community. You were telling me this in your notes, that you see rates go up of mental health issues, right?
Right.
Yeah.
There's no way to be going through something so terrorizing and have your daily safety threatened and for your physical health to be well. I mean, even when we just talk about sleep and anxiety and worry, and then we talk about all the other impacts you see corresponding with, you know, issues with, you know, poverty and access to resources, and that what that takes a toll on a physical body. They're absolutely related. There's an economic cost to domestic violence.
Addiction, does it contribute more to addiction?
When you think of addiction, really throughout. So, you know, when you think about victims of domestic violence, people are experiencing that. Loved ones, when you also look at the rates of people who engage in abuse and addiction, I mean, they're all such overlapping and entwined issues.
Okay, and then for the greater community, it contributes to a growing lack of connectedness and growth.
So when you think of what constitutes a healthy community, a healthy community has a workforce that's employed, a healthy community has community action and events, has ability for people to interact socially with one another. When you think about domestic violence, it's incongruent with what happens in a healthy community. Yeah,
it takes away all of those, the want to do those things, the ability to do those things.
To reach out and help each other, to have events, to have any sorts of healthiness of what constitutes a community that anyone would want to live in or visit. Certainly chronic violence is not going to be a part of that.
Okay, so explain this in your notes. You said a community is more than a collection of residents. What do you mean?
That's right. When you think about your neighbors, your neighbors are not just that person that lives next door that you may or may not see. Their health and their ability to do well impacts you. When your neighbors are struggling and your neighbors are unsafe and your neighbors are not contributing, then it impacts you. So we need to change our focus and our narrative that the person down the street has nothing to do with me. We are living together. We're interacting together. We're impacting each other. We have a collective sense of community, whether or not we want to acknowledge it.
I think what's unfortunate is that has become sort of politicized. That's political now.
Right.
And that's unfortunate.
It is unfortunate because you live amongst your neighbors. So when your neighbors are doing well, you're doing well. When we live and we try to turn a blind eye to violence and things that are happening because we don't want it to impact us, it's not that it's not impacting us, we're just not being honest about it.
Okay, we have 1 minute, so we want to get to these interventions and community response. You say it begins with how community leaders and groups talk about violence.
What is the language about it? Who are we shaming? Who are we holding accountable, and who are we supporting?
And often that falls along racial lines, gender lines. Okay. And then lean into resources for screening tools for children and adults.
Let's look at how mental health for children and adults are being impacted, actual screening tools.
Okay. Cultivate resources to include food banks, support groups, and shelters. And we have all of those here.
So we do,
yeah.
But we really want to lean into it and expand it, because people who are struggling with violence are struggling with insecurity with food, access to resources, socioeconomic difficulties.
Yeah.
So let's think about all of those social supports that we want to feed.
And how we can expand it even
Absolutely.
further. Okay. And then growth begins with language which reflects values and safety.
So let's think about this. What does our community value?
Yeah.
What do we value for each other? And let's start to talk about things that say that we value for people in our community to be safe.
What I think is difficult about that as well is I think in so many cases we're not sure about our values because of the politics.
That's correct. And I think that we have more in common than we have apart. And when we can lean into those things, we can find that we actually truly do want to help our neighbor.
I think so too. All right. It really all does come back to mental health. It does. That's why we can have these discussions. Thank you, Mary Jo. And you can watch this segment and all of our others at WSAV.com/Wellness Wednesday.